name is Ronlonda Foley, RN to BSN nursing student at Tennessee State University, Health Assessment, Summer 2014. I'm going to be assessing Erin Foley. Okay, Erin, tell me your name.
Erin Foley.
When's your birthday?
July 13th.
What's today's date?
August 4th.
The year?
2014.
Good. So he is alert and oriented ×3. I did Erin's vitals and his eye chart prior to this test. His blood pressure was 80/60. His pulse was 80. Temperature 98.3. Respirations 18. Erin is 4'9". He is 100 pounds and he's 12 years old. Erin, I'm going to assess your gait. Can you walk 1 foot in front of the other one to the edge of the room and then come back? Good. Turn around and come back. Thank you. Erin has good posture, good gait. Okay, so I'm going to do the head to toe assessment, and I'm going to start with Erin's head. Okay, set up. Erin, come on. Okay, his head is round, even hair distribution, brown. I don't detect any lesions, any scars. It's normal cephalic. Erin's facial expression is good. I'm going to assess his frontal bones. Okay, his occipital, his frontal, his parietal, his temporal, his zygomatic, his nasal, his lacrimal, and his maxillary. All bones are intact. I'm going to assess his sinuses, his frontal, sphenoid, ethmoid, maxillary. Erin, did you feel any pressure? No. No. Good. No problems with sinuses. I'm going to assess his cranial nerve 5, cranial nerve 7. Eric, you might want to come in a little bit. Cameraman, you might want to come in a little bit. Can you clench your teeth? Good. Can you wrinkle your forehead? Good. Can you squeeze your eyes shut? Smile. Puff out your cheeks. Stick your tongue out and move it side to side. Good job. Can you feel this?
Yes.
Good. He can feel light sensations on his forehead, cheeks, and skin. Sinuses and cranial nerves intact. I'm going to assess Erin's lymph nodes. His occipital, preocular, postocular, tonsillar, his cervical, and his subclavicle. No nodules present or palpable. Next, I'm going to assess Erin's eyes. His eyes are symmetrical, eyebrows symmetrical, eyelashes clear and free from debris, symmetrical. His conjunctiva is pink, eyes brown, and he has equal and reactive pupils. Good. Okay. So we're going to test Erin's accommodation. Can you see this?
Yes.
Okay. Now can you see this?
Yes.
Good accommodation. We just tested Erin's 3rd, 4th, 6th, and the visual field cranial nerves 2. There was no drainage present, no ptosis, no drooping of the eyelid, and he has no pain in his eyes. Next, we're going to assess his nose. Nose is intact, no drainage, no marks on the outside, clear inside, good turbulence. Next, we're going to assess Erin's mouth. His lips are pink, not crusted or peeling. His inside of his mouth is pink, accurate teeth for his age. His uvula and tonsils, posterior pharynx are all intact, no mouth odor. So we just assessed cranial nerves 9, 10, and 12. And we need to do Aaron's ears. Okay, his ears are intact, symmetrical. I'm going to look inside. Okay, pearly gray, no redness, no debris. And I'm going to do the Wren and the Weber test.
I can hear it.
Good.
I can hear it.
Good. So we've completed his head, his eyes, his ears, his nose, and his mouth. We've assessed for the lymph nodes. Everything was normal. Nothing was palpable. Okay, now we're going to assess Aaron's neck. It's clear, free from debris, symmetrical. Okay, I'm going to assess his thyroid. If you can't swallow for me, good. Thyroid is not palpable. Okay, I'm going to test his range of motion. Can you turn your head to the right, to the left, look up, and have your chin touch your chest. Good job. Good range of motion in his neck area. I'm going to palpate his jugular vein. Bounding +3. Very good. So he had, his thyroid was not enlarged, no nodules, and I was not able to palpate it. He also had good range of motion in his neck. Now we're going to move down to his chest area. Can you take off your shirt, please? Good. Okay, good. Okay, sit up straight. Okay. So his chest is intact, no lesions. Okay, good. And we're going to look at his skin. Skin is good, intact of his upper extremities. Good skin turgor. No redness or swelling in his hands. 3+ capillary refill. Can you push against my hand? Good. Good. Good strength in his hand. We're going to assess range of motion. Have your arms straight out. Now pull them in. Abduct. Abduct. Reach up to the sky. Good. He has good range of motion, good strength in his upper body. Palpating for axillary nodes. None palpable. Sit up straight. Sit up straight. Okay, so he had good range of motion, good symmetry in his shoulders, good muscle skeletal development. Okay, we did range of motion. Let me palpate radial pulses. Good and bounding. Brachial pulses. Good and bounding. Okay, so now I'm going to assess Aaron's lungs. Take a deep breath and let me look at you. Breathe in. Good. He doesn't have any problems breathing. No not a hard time with his accessory muscles in breathing. Okay, so I'm going to listen. Anterior, breathe in. Good. Breathe out. Okay. And I'm going to listen posterior. Breathe in. Good. Breathe out. Good. Now, while I'm listening to him, I'm going to do a cardiac assessment and listen to his heartbeat. Okay. Aortic. Pulmonic. Herb's point. Mitral. Tricuspid. Mitral. Good. And I'm going to listen with the bell. Good. Now I'm going to assess his lung sounds posterior. Can you say 99?
99.
Good. 99.
99.
99.
99.
99. Good. No tactile fremitus present. He has good breath sounds, a regular breathing pattern, no use of accessory muscles, no cyanosis. Breath sounds are equal and clear to auscultation. Good. Okay, so we expected his skin and his symmetrical respirations. His posture was good. Respiratory effort good. No pulsations, no heaving. We inspected for lifts and heaves, and we auscultated his heart sounds. His heart rate was 60 to 100, regular rhythm. I heard S1, S2, and he had capillary refill of 3. No edema present. Okay, now we're going to inspect his breast. Can you come in with the camera? breast nipples symmetrical, not enlarged, and we didn't palpate any swollen breast tissue. Good. Okay, now we're going to assess his abdomen. Okay. If you turn to lay down, I want you to lay at a 45-degree angle. I'm going to palpate his carotid. Good. Bounding +3. Can you scoot all the way down so I can do your stomach? Great. Okay. I'm inspecting his stomach and it's clear. No lesions, no masses. I'm going to listen to each quadrant. Okay. He has positive bowel sounds in all 4 quadrants. I'm going to assess his inguinal nodes, no nodes present, and his femoral arteries, bounding +3. His umbilicus is midline, and I don't feel liver or spleen or any enlargements. Okay, now Aaron, we're almost at the end, and we're going to do your lower extremities. Okay, his skin is dry and clear. His toes, can you fan your toes out? Good. He has good capillary refill in his toes. He has good pulses. I'm going to do Babinski's. Okay. Now if his toes fan, there would be a problem, but his toes didn't fan. Okay. No crepitus in the knee, and we're going to do some range of motion. Can you abduct, pull your knees to you? Okay. Out. Can you open them? Good. Okay. He had good deep tendon reflex. No Babinski's. Muscle strength was good. Can you push up against my... Good muscle strength in his lower extremities. Okay, we're coming to an end, and we're going to do his cerebral function. Okay, can you put your finger to your nose? Now to my finger. Good. We're going to do breathalysis. I'm going to write a number in your hand. Can you tell me what it is?
1.
Okay. We're going to test your smell. Can you smell this?
Yes.
What is it?
Perfume.
Okay. Okay. And then we're going to test his senses. Is that dull? I mean, can you tell me if it's dull or if it's a prick?
Dull. A prick. Dull. A prick.
Okay. And while we're down here, I'm going to assess his reflexes. Good. So his neurovascular assessment was intact. So I have completed the head-to-toe assessment on Aaron Foley. Thank you. Stop.
Yeah,
Be on YouTube.